Welcome back to the Deep Dive. Here we don't just skim the surface. We really try to plunge right into the heart of complex information, pull out those crucial insights. Our goal is always to get you truly well-informed, fast, and maybe with some things you didn't expect along the way. Today we're embarking on a particularly, intricate journey. We're going to dive deep into the comprehensive medical history of an individual named Joseph Maldonado passage. It covers several years. It's a fascinating and, honestly, at times, an incredibly complex story. Lots of health challenges, treatments, and even a really significant request for compassionate release.
That's right. And the sources we're working with today are truly extensive. We have a whole collection of medical records, diagnostic reports, notes from consultations, medication records, official requests, you name it. What's really compelling here, I think, is that this isn't just, a list of diagnoses. It really paints a vivid picture over time. You see the ongoing care, the challenges of managing multiple conditions simultaneously.
Okay, so our mission today is to really unpack that progression, understand his health journey over this period, the treatments he got, the key decisions made about his care. And we're focusing entirely on the objective information in these documents, right? Letting the records tell the story.
Exactly. Stick to what the sources show us.
Okay, so let's start at the beginning then. As we open up Joseph's file, one of the first things that really jumps out, and it seems pretty critical, is this extensive list of allergies. Yeah. That's not just a minor detail, is it?
Oh, not at all. It's foundational, really. The records from back in September 2018, they highlight some crucial warnings. Allergies to Demerol, penicillin specifically noting a rash reaction there, and then a whole group of opioids like morphine, Lortab, oxycodone. All those caused significant nausea for him. So knowing that upfront is absolutely vital for any pain management decisions, any prescriptions down the line,
Right.
it immediately flags certain drugs as just, off limits. And that complicates things right away.
Sure. And beyond those allergies, his history quickly shows this pattern of persistent issues. Dental health seems to be a recurring theme pretty early on.
Yeah.
Suggests ongoing discomfort, I imagine.
Indeed it does. The dental conditions are quite prominent, and they seem like a constant battle for him. We see entries for dental caries, that's cavities, in November 2020. A retained dental root mentioned twice, April 2020, and again March 2021. Recurrent oral aphthay, those are those painful mouth sores, in March 2021. And even cellulitis and an abscess of the mouth in December 2020. Plus a dry socket noted later in October 2022.
Wow.
What's significant is, like you said, these aren't just one-off things. It's a consistent, challenging oral health situation. Must have impacted his daily life quite a bit.
Yeah, I can only imagine.
Yeah.
And it wasn't just the dental issues back then, right? His records also show early struggles with GI problems and skin conditions, too. Adds to the picture.
You're right. It broadens the picture of his chronic health issues. The records show gastroesophageal reflux disease, GERD, diagnosed September 2020, though without esophagitis. Psoriasis noted in September 2022, and even unspecified skin changes logged back in August 2020.
Okay.
So these things collectively establish that baseline of chronic ailments, kind of the medical background noise he was always dealing with. It really shows how health journeys often aren't about one big thing, but the sort of compounding effect of multiple chronic issues.
That's a really key point. And you mentioned earlier musculoskeletal complaints, too, like osteoarthritis. That seems to set the stage for later issues with pain and mobility.
Absolutely, it does. The records from April 2020 already mention osteoarthritis of the hip. Then there's cervicalgia neck pain noted in June 2020, and sciatica, also from April 2020. These aren't just minor aches. They're established conditions that would definitely impact his ability to move comfortably. It's a clear reminder that these seemingly separate issues often connect and add to the overall health burden, even before, the more critical diagnoses pop up.
Okay, so we've established that foundation of chronic issues. What was the big shift then as we move into 2022? Sounds like this year was a real turning point for him.
It really was. 2022 marked a major shift. The picture gets much more complex. Records show two really pivotal diagnoses in May 2022. First, an immunodeficiency syndrome, which was later specified as CVID, Common Variable Immune Deficiency, and second, prostate cancer.
Wow, both in the same month.
Yeah, and these weren't just new labels. They immediately required pretty intensive treatments. IVE, that's intravenous immunoglobulin for the immunodeficiency, and for the prostate cancer, a combination of ADT, androgen deprivation therapy, along with radiation.
Those are serious interventions.
Very serious systemic treatments, a huge escalation in his medical care.
Astonishing how quickly things intensified. And then kind of woven into this, you mentioned some confusing information about his COVID status around then.
Yes, this is where documentation gets a bit, well, murky. In October 2022, there are two different screening entries around the same time. One record states clearly he received Janssen, Pfizer, and Moderna vaccines,
Uh-huh.
but another entry, right around then, explicitly says he was not vaccinated against COVID.
Huh. That's a direct conflict.
It is. And it's not just a minor typo. It highlights a real challenge in complex medical record systems. How do you reconcile conflicting info like that, especially when you might have patient reporting, outside records, internal notes?
Right. Which one do you trust?
Exactly. It just underscores how critical data integrity is because these discrepancies could genuinely impact care planning.
Absolutely. And then, as if his body wasn't dealing with enough, he has an ankle injury in late 2022.
Precisely.
Yeah.
Another layer of physical challenge. He had a fall in December 2022 or injured his ankle. The x-rays, thankfully, didn't show a fracture or any misalignment,
Oh.
but they did show significant soft tissue swelling. And interestingly, a 4 millimeter enthesophyte right where the Achilles tendon attaches.
An enthesophyte. And what is that exactly?
It's basically a bony spur that forms where a tendon or ligament attaches to bone. And finding that there connects directly back to his earlier history of osteoarthritis.
Ah, okay. So another sign of that degenerative process.
Exactly. Suggests another area of chronic musculoskeletal discomfort that's adding to his overall burden.
So with all this going on, the CVID, the cancer, the chronic issues, the injury medication management must have become incredibly complex.
Oh, absolutely central. The medication list for this period is extensive. It really reflects the sheer complexity. You've got key prescriptions like dexamethasone, probably for immune modulation, Aimovig for migraines, Rimidone, listed for epilepsy or seizure disorder, tamsulosin for the prostate issues, omeprazole for his GERD,
Mighty cocktail.
and others too for anemia, for pain, for those recurring mouth sores we talked about. What's also really noteworthy here are documented instances in November and December 2022 where Joseph actually refused certain medications.
Oh, interesting. Why?
The notes say he was citing instructions from an MD or maybe communications from a pharmacy. It's not just about, non-compliance. It signals a degree of patient agency, him being involved in his care decisions.
Right.
Which is important, but can also be complex for the medical team to navigate.
So moving into 2023, it sounds like the care gets even more specialized, focusing heavily on the prostate cancer and the immunodeficiency.
That's absolutely right. The focus intensifies. By February 2023, there are urology consults specifically for the prostate cancer and also for hematuria.
Hematuria, blood in the urine.
Correct, blood in the urine. The records note his history of a Turok procedure, that's a transurethral resection of the prostate, way back in 2014. And critically, his PSA levels, the prostate-specific antigen marker.
Yeah.
They had been undetectable in September 2022, but by March 2023, they had crept up to 0.2.
Not a huge number, but a change.
Exactly. Not high, but a definite change from undetectable. So that prompted more investigation. The plan included CT scans, urine cytology, and an office cystoscopy to really evaluate what was going on.
Okay, makes sense. And then amidst all this, a completely new concern pops up, breast issues.
Yes, adding yet another layer here. In May 2023, there was a clinical encounter noted for bilateral breast tenderness and lumps.
Okay.
So they did a diagnostic mammogram in July 2023. The finding was probable benign mammogram and ultrasound of bilateral gynecomastia. They classified it as Biard's category 3,
Which is
generally means it's likely benign, but you need to keep an eye on it. Do follow up. The report even listed potential causes hormonal imbalance, various drugs, which makes sense given his complex medication list.
Sure.
But then, just a few days later, another ultrasound in July 2023 was reported as negative for solid or cystic mass.
So conflicting findings again, or maybe just evolving.
It could be either, or maybe
Yeah.
different interpretations. It really highlights the nuances of diagnostic imaging. Imagine being the patient. It raises questions, maybe anxiety, when you get slightly different results close together.
No kidding. And meanwhile, those chronic oral health problems, the mouth sores,
Right.
they just kept going.
Despite the earlier dental work, they absolutely did. It seems like a relentless issue for him. This is a significant point. Oncology notes from October 2022 specifically quote him complaining his mouth was full of mouth sores.
Wow.
And these problems were still being mentioned in March 2023 oncology reports, even after all those dental procedures we talked about earlier.
So incredibly difficult to resolve that.
Exactly.
Right.
It points to this chronic, really bothersome symptom that must have severely impacted his quality of life, his comfort, even while facing these other huge diagnoses. It's just a constant reminder that for patients, it's often the combination of things that makes daily life so challenging.
Yeah, absolutely. And then early 2024, a significant CT scan turns up some new findings. Lungs and cardiovascular system this time.
That's right. The January 2024 CT chest scan brought new things to light. It identified a 1.3 centimeter pulmonary nodule in his left lower lobe.
Okay, a lung nodule. Needs watching.
Definitely needs monitoring.
Yeah.
The scan also showed mild emphysema and calcifications in his aorta and coronary arteries.
So signs of cardiovascular risk there too.
Significant indicators, yeah. It just adds more layers, lung health concerns, cardiovascular risk, really underscoring how multisystemic his medical journey had become. Things in one area potentially affecting others.
Okay, this brings us to a really pivotal moment, and one that feels quite emotionally charged. His request for compassionate release in June 2025. This seems deeply personal, rooted in his own experience of everything we've just discussed.
It absolutely is. You can see it in the handwritten letter he submitted. He clearly lays out his reasoning. He highlights his CVE, the immune deficiency, stating very plainly it requires blood infusions every 6 weeks, which he perceives as necessary to survive. He also cites his prostate cancer, and then critically he refers to tumors on left lung, likely referencing that nodule, and explicitly says he's afraid of more testing because of a past life-threatening infection.
That's a powerful statement of fear based on past experience.
It is, and he notes he's been incarcerated since September 2018, served over 84 months of his 259-month sentence. He's emphasizing the duration and his profound belief that his health has seriously declined while inside.
So he presents this very detailed, personally felt case based on his extensive medical history. What happens when the institution, the Bureau of Prisons, reviews a request like this? How do they handle it?
Well, the BOP responded in July 2025, and their review led to a denial of his request.
Denied. Why?
The official reasoning provided was, according to their assessment, that his illnesses are not considered life-threatening. They stated he does not have a higher mortality rate compared to your peers.
Okay.
They also asserted that his prostate cancer and his immune disorder are being effectively treated within the BOK system, and critically, that he is able to perform all activities of daily living independently.
Wow, that sounds very different from his perception.
It highlights a significant discrepancy, doesn't it? It's a really powerful example of that inherent tension. On one hand, you have the patient's subjective, lived experience of their body, their illness, their feeling of survival and deterioration.
Yeah.
And on the other, you have the institutional medical assessment, which relies on objective criteria, statistics, specific guidelines to determine eligibility.
It's like two different worlds colliding.
Exactly. It's a crossroads where those two perspectives often diverge quite sharply.
What an incredibly detailed and, often challenging medical journey we've just walked through for Joseph Maldonado Passage. From those chronic dental and GI issues way back at the start to these really complex diagnoses like the immunodeficiency, the prostate cancer, even the lung nodule, the gynecomastia. His medical file is just extensive. It's really a testament to a life lived with compounding health challenges.
Absolutely. And these sources, they give us a crucial window into the care provided over these years, the sheer array of medications that needed managing, adjusting, significant clinical decisions too, like tweaking his IVIG frequency from every 2 weeks down to every 6. And then, of course, the rationale behind denying compassionate release based on their specific medical criteria. It's a complex tapestry.
It really does highlight that intricate, maybe delicate balance between managing multiple chronic conditions,
Yeah.
the patient's own personal experience of their health, how they feel, and then the objective medical assessments and the institutional rules that guide treatment and these big administrative decisions.
Right. And it brings us back to that crucial divergence we just talked about. It really poses an important question, I think, for you, our listener, to consider. How do we as individuals, as a society, navigate that gap, the gap between a patient's subjective understanding of their own body, their suffering, and the objective medical data, the institutional criteria that end up shaping their care, dictating these huge life decisions? What really stands out to you in this deep dive when you think about those very different perspectives on health and well-being?